The campaign battle over Initiative 185 just keeps getting more and more expensive. It's now topping $17 million in cash raised or spent by both sides. Initiative 185 would raise state tobacco taxes and make permanent Montana's Medicaid expansion, which provides health coverage to nearly 100,000 low-income Montanans. Tax revenue from I-185 would help pay the state's cost of Medicaid expansion, as well as fund some other state programs. Altria Client Services, the maker of Marlboro cigarettes, put another $3.5 million into the campaign against I-185 last month, upping its total to $7.5 million. All told, two tobacco companies have put more than $12 million into the anti-I-185 campaign. The supporters of I-185 kicked in another $2.7 million to their campaign last month, with most of that from Montana hospitals. I-185 supporters have raised or spent a total of nearly $5 million on their campaign. Today in Billings, some of those supporters, including Governor Steve Bullock and hospital representatives, were on hand to show support. The governor supports the initiative and says it's good for our economy and it's good for the health care of Montanans, our seniors, and our veterans.
What it does is it fully funds our Medicaid expansion population, which is about 100,000 Montanans that get health care. Provides new money for senior citizens, for our veterans, and it also provides dollars for tobacco cessation and prevention.
From an emergency physician's perspective is access. This provides primary care access to reduce health care cost and utilization, and that affects us all. When the cost of insurance is increasing faster than the rate of inflation for a decade, we've got to stem the tide, and this is one of the ways.
Opponents of I-185 are opposed to permanently funding Medicaid expansion. They're concerned about what they call the high cost of the program.